Brain cancer. Cancers of the brain and spinal cord tumors are often found because of signs and symptoms the person may be having, however these are often experienced at later stages. If a tumor were to arise in the motor cortex, for example, the area of the brain involved in controlling voluntary movement, it would cause a noticeable deficit such as weakness in the arm or leg, explains David Pullet, MD, board-certified neurosurgeon in Union, New Jersey. However, these tumors may often arise in neighboring areas where they would cause somewhat vague symptoms to a patient such as clumsiness of the hand in performing fine motor tasks, as opposed to frank weakness or subtle difficulties with speech. Patients may also exhibit very subtle changes in personality that may only be noticed by their closest family members. Liver cancer. Because no symptoms are present until later stages, liver cancer is another hard-to-detect cancer. If the tumor is small, it's especially hard to detect on a physical exam because most of the organ is covered by the right rib cage, explains Dr. Fikri. By the time the liver is large, the tumor has likely spread throughout the organ, beyond the point of being totally removed surgically, but leaving enough healthy liver intact. While there are no widely recommended cancer screening tests for liver cancer in those not at risk, your doctor may recommend testing if you have a family history of the disease or have been previously diagnosed with the human papillomavirus (HPV). Many patients who are alcoholics develop liver cancer after long-standing cirrhosis, or liver disease. Pancreatic cancer. This rare disease makes up only 2% of all new cancer cases in the country, but it recently surpassed breast cancer as the third most common cancer killer in the United States. So it's safe to say cancer screening strategies are desperately needed. Kidney cancer. Kidney cancer can be hard to detect because patients aren't usually tested unless they show the symptoms, which often include lower back pain, chronic fatigue, unexplained weight loss, and blood in urine. Because the kidneys are so deep inside the body, small kidney tumors cannot be seen or felt during an annual physical exam, explains Chris Fikri, MD, Vice President of Oncology at Quest Diagnostics. Additionally, there are no recommended screening tests for kidney cancer in people who are not at increased risk. Patients who have certain inherited conditions, such as von Hippel-Lindau syndrome (VHL), hereditary papillary renal cell carcinoma (HPRCC), and Birt-Hogg-Dubs syndrome (BHD) have a higher risk of kidney cancer. Non-small cell lung cancer. 3/4 of lung cancers are diagnosed after they've already spread. And often patients do not become symptomatic until the cancer has already grown to a size that causes lung cancer symptoms such as cough, pneumonia, shortness of breath, and has already made its way through the bloodstream and lymph system. Non-small cell lung cancer (NSCL) is the most common type of lung cancer, yet it's difficult to detect early on because early-stage lung cancer often has no symptoms and is not detected with a chest X-ray. Positron emission tomography (PET) and CT scans can be helpful in diagnosing lung cancer. A doctor may also take cancer cells from lung secretions, fluid around the lungs, or through a biopsy for a confirmatory diagnosis, which typically happens in a later stage. Ovarian cancer. While ovarian cancer only accounts for about 3% of cancers among women, it's the fifth deadliest cancer, accounting for more deaths than any other cancer of the female reproductive system. According to Cancer.org, an estimated 22,280 women will receive a new diagnosis of ovarian cancer this year alone, and approximately 14,240 of those women will die from it. Like other cancers, the earlier the diagnosis, the better the outcome, but only about 20% of ovarian cancers are found at an early stage. Watching for these ovarian cancer symptoms can help. This is mainly because of the size and distensibility of the abdominal cavity and the fact that there are no symptoms from small, early-stage ovarian cancer, says Joe O'Connell, MD, Vice President of Oncology and Hematology at Inventive Health.